Your cold is coming! Your cold is coming! When you feel a cold coming, shorten it with Zicam, the #1 cold shortening brand.
Oh no, not before my big trip.
The big trip you've been planning is coming up, and so is your cold. But Zicam can shorten your cold and get you back to planning sooner.
Thanks, Revere.
We really should keep Zicam in the house.
Shorten your cold with Zicam.
Take it from America's most revered messenger. Shorten your cold at the first sign with cold shortening products from Zicam, the #1 cold shortening brand. Available in stores or see where to buy at Zicam.com.
Welcome back to What's Next with Lacey, the podcast where I interview young professionals about their career journey so far. Hello friends, welcome back. I am so glad you're here for another episode, another story, another career path. If you're new to the show, welcome to the What's Next family. This is the place where we get inspired, we learn from others, and figure out where our own career paths might take us. This week's guest is extra special, one of my best friends from childhood, Maria. She is now a dentist in England, focusing on oral surgery. Yes, like taking out teeth and stuff. So cool. Maria's path has been fascinating. She's moved around the country. She's worked in hospitals. Did you know that dentists do night shifts? Because I did not. And she has earned her spot in some of the most competitive programs in her field. She's incredibly passionate about what she does, and I think you'll love hearing how she's carved out her own version of a quote-unquote traditional path. One quick heads up, my mic had a little bit of a meltdown the day we recorded. The joys, the utter joys of podcasting on a budget, so the sound isn't perfect, but Maria's story more than makes up for it. So, without further ado, here's Maria. Maria, it is so lovely to see you. Welcome to What's Next. How's it going?
Lacey, thank you so much for having me. I'm honoured. I can't quite believe it. But no, I'm really, I'm doing well, excited to chat to you as a friend, but also to, I guess, like to share a little bit about snippets of my life professionally, I guess. I guess you know me really well personally, but it's more from a professional point of view that might be quite interesting. Not that it's going to convince you to go and do my career, but maybe inspire someone.
I think it might be a little bit too late for me to turn around.
Never say
but
never.
You know, that's true. Never say never. I might have to go back to like do undergrad again to study like biology and chemistry, but sure, I could do that.
IB, you know, you could go back to the IB days. We loved IB, so.
Oh my gosh, if I had to go back to my IB days, that truly would draw the line. I have never worked so hard in my life than the IB. I'm convinced of it.
But people ask me, like, what part of your life did you really enjoy? And I always talk about other parts of my life as well. And I know that there's also amazing things to come. But I always go back to sixth form at school as an absolute highlight.
Oh, 100%. It was the hardest I've ever worked in my life. But truly, like, two of the best years.
Yeah.
Like, I absolutely loved sixth form. We had such a great crew. It was such a great group of students. Like, the 20 of us that did IB at our school, our high school or secondary school. Godolphin and Latimer. But yeah, no, absolutely. It was truly two of the best years, but also two of the hardest.
It was tough, but I think it really helped us. And it's interesting because we both went down such different career paths, even like as undergrads. Yet I think we both take so much from the IB in our different ways with it. And I always, when people are like, what did you do for A-levels? I say, let's rewind. I did not do A-levels. I did IB, and I'm so proud. Mainly because we went on a fun trip afterwards to Ibiza. But other than that, I did also enjoy the program.
Yeah, no, that trip to Ibiza was pure good men's. But that trip was pure craziness. But we had to do Ibiza because we did IB.
Yeah, exactly. It was a must. I feel like the school would have probably funded it if we'd asked.
Honestly, if to any Godolphin girls who are listening, ask Godolphin if they will fund your IB trip to Ibiza. I doubt that Godolphin would say yes. But hey, again, theme of this episode, never say never.
Yeah, literally.
All right. Speaking of all of this, let's dive in to your career, to your experience, to what you have done since the IB, since that 10 years ago.
Yeah, that's 10 years ago.
10 years ago. I cannot believe it. But yes, you were a dentist.
Yes.
Yeah. Confirming that.
Good night.
And that's our episode for you, ladies and gentlemen. I hope you enjoyed. Why don't we start with dentistry has a crazy path. I mean, I feel like it's kind of like medicine in that same way, and that there's like such specific steps that you have to take in order to like get to your final goal, get either the specialty you're focusing on or get to like having your own practice or whatever it may be. So why don't we start with simply, can you explain for our listeners what happens from the moment you graduate university to like once you've finished your training?
I love how you elevated dentistry to the level of medicine as well. I think most of my medic friends and my family would laugh, but I think it has an importance.
Why?
Just because I think the medics, I was speaking to a medic yesterday, he's actually in GP training, and just saying that it's so interesting how you study for the same amount of years around that at university, yet you only really focus on one area. But I think that in a nutshell just explains, I think, how dentistry is misunderstood in the healthcare world, and also on the back burner for so many different reasons. But anyway, we'll dive into that, I'm sure. But yeah, so I graduated in 2020 from the University of Bristol, which I love. Amazing, amazing city, amazing place, amazing people. Lacey loved it.
I did.
But I think what makes dentistry so unique is because you come out of dental school kind of ready to get into work and get going. So I always used to say when I was studying dentistry that you kind of live in a parallel world to other people who are studying at university, because we had a bit more responsibility than others. We were already treating patients from second year. We'd start with treating them with their gum health, doing the sort of treatment that dentists do, or, they can either gum specialists do as well, but other parts of dentistry do this sort of treatment as well, whether you're a dental hygienist. So really starting with the basics and the foundation actually of dentistry, which is gum health and making sure that is healthy. So you started with that in second year. Even I think that might have changed. I think you might have some input in first year. And the reason they do that is that they build your skills to the point that by the time you finish dental school, you actually can start treating patients in your first year when you get out. So that's something that I actually really enjoyed. There was so much hands-on, there was so much skills there, in the sense of, I think we would sometimes have like 8-hour days. And some of my friends who did like law, let's say, would have, or other degrees, would do 8 hours in a week or like over a period of a few days. So it's a really different experience. But anyway, you come out with the ability to actually, you're a qualified dentist and you can actually treat patients. That is why it's different to medicine, because in medicine you go into hospital and you are supervised a bit more. You start slow and then it really cranks up. But in dentistry, when you graduate, most people, what they do is that they do a year called dental foundation training, which is when you work in a practice that is set up to have first year graduate, and you have your own patients, but you're supervised at a distance from a really qualified dentist who's been in the game for many years and is called an educational supervisor. And that is a kind of great way to be able to treat patients and become more independent in your treatment planning and actually carrying out treatments. And patients can pay for this treatment as well, under the NHS dentistry, or if they're exempt, they don't have to pay for NHS dentistry. And then that kind of is a great way to sort of get your feet into NHS dentistry, understand how that works. And then the world is a bit more your oyster. I think people don't realize how varied dentistry is. You can then decide to continue working within NHS dentistry in practice. Some people start adding in private dentistry with that as well. And some people say, I don't like the NHS, I'm going to go fully private. And I think some people do end up doing that, and I can understand why. And the crazy ones, like me, decide I just want to go into hospital world, because I didn't actually realize that was something you could do until later on in my undergraduate at university. But if you decide that you want to, maybe you find a certain part of dentistry interesting, you can decide to specialize in that. That's not to say you have to be in hospital. You can actually do specialties privately, like paying, you go back to sort of university and you do a master's in those sort of specialties, and you come out as a sort of more of an expert in those areas. But if you want to become like a consultant in England, an NHS consultant, you do have to go through usually a more formal pathway where instead of you paying to come out as a specialist in it, you actually get paid to do it by doing a training program in dental hospitals. But to get there, you have to do a few years in hospital as well. You can do it up to 3 years of like a formal training pathway. That's called dental core training. It's dental core training 1, 2, and 3, which is again national recruitment in England, where you have to go through interviews and a few exams as well to then be able to learn more about different specialties while working in hospital. And then after that, people continue to work in hospital even if they're not part of this program. They're specialty doctors, which is what I am at the moment. And then afterwards, you can enter specialty training, which is when you become a registrar to then become eventually a specialist and hopefully a consultant in the future. There's loads of other avenues, but that's kind of what some people do. They want to go into specialty training.
So you said you want to be this consultant. You've done this specialty training, dental like core 1, 2, and 3, or you're doing it. What is the end goal? What do you finally want to end up as? And what stage are you currently at?
Yeah. So yes, what do I want to end up? Where's my end goal? I'm not entirely sure yet. I know that I finally managed to get to a part in my professional career that I've been wanting to get to for a while. And getting here wasn't easy with regards to the work that I had to do in the areas that I had to work in, but also wasn't easy mentally in the sense of thinking, am I even able to do that? Is this something that I will be able to do? Am I the right person for it? Among other people who are amazing and are going to be doing it too, but is this the right thing for me? I think long term, what I want to end up doing is be able to, the jobs that I've done has really shown me that dentistry in England is really struggling. And I think those that really struggle are those that can't access treatment. And I think they then unfortunately have to end up being in hospital because they have life-threatening swellings or they have problems with their teeth that's like the worst case scenario. You never think, gosh, people die from dental infections. I've seen bad dental infections that have come to that point. So I guess wanting to get to a point where being able to do something that I enjoy, which is oral surgery, which in a nutshell is taking complicated teeth out in a way that is as painless to patients as possible. But there's other elements to it as well. It's a surgical aspect of dentistry, maybe implants as well, or removing certain cysts as well. That's probably, I want to help people by taking teeth out, which is what people would say I'm a bit crazy. My friends laugh when I talk about taking teeth out like it's my passion, but I really do enjoy it. Being able to help people in that sense, because teeth can hurt if they're not were looked after well. So being able to help people get out of pain, but also doing something that I enjoy. I wouldn't say I'm as strong in things such as when teeth are removed, replacing the gaps there. So I kind of want to deal with the stuff that I enjoy and that helps people get out of pain, and then work collaboratively with my colleagues to give them what they want in the end goal. But so long term, I want to be a master in my field of oral surgery, but also with a side of trying to improve dentistry within England at a level more like a population level, let's say. And that involves a lot of understanding the system and seeing if it can be improved in a way to help those that have difficulty in accessing care. Once they're able to access care, making sure that they're down the right pathway to achieve that. And so that's something that I've been looking at more this year, and I'll go into that. So graduated dental school, did my foundation training in Aldershot, which is like the coolest place ever, military-wise. There's like a, what's it called? Sandhurst is around there. So I was there, I'm going to go there, meet some hot army people. They were all retired army people, so not as hot, but nice nonetheless. And it was during that, it was COVID year that year. So I really had a very different experience to what I'd heard other people would have had beforehand. I think they had much more hands-on in the sense of bam, 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 seeing lots of patients. And for us, it was a little bit more delayed because we had to clean the rooms afterwards in order to make it COVID friendly, etc. And I think that's where it kind of scared me a bit, thinking, I don't think I'm ready to enter the world of NHS dentistry because it's very heavy. Like the people that do NHS dentistry are the real saviors of dentistry in England. Like they are the people I respect the most. I'm not ready.
Why do you say that?
Because it's very easy in dentistry in England to jump the bridge onto private dentistry. You can make a killing there, like a real salary, like financial, like killing.
Not killing your patient.
No. Then you have other problems. But sort of, it's very easy to go down that route, and that's what a lot of people are doing because NHS dentistry is not paying the dentist in the way that they deserve. the way that NHS dentistry is sort of split in how they get paid depends on certain treatments that they do, and they get banded into different treatment categories. But the amount of work that one patient may need, that the dentist will receive the same amount of money if they treat another patient that needs less treatment. So two patients one could need loads of treatment, another could need less treatment, but the dentist gets the same amount of money at the end, and the patient pays the same amount of money, whereas that's not the case privately. So there's a real issue at the moment in sort of dentists not wanting to do NHS dentistry because they're not getting the financial gains that they get in private. So in order to make a killing, you have to understand the system, be ethical and moral when you do it. But that involves seeing patients, like being really efficient and doing it well. And I, at the stage that I was at, was efficient in the work that I was doing, but it meant that I wasn't seeing many patients because I was making sure I was doing things properly, in quotation marks, for my level and my standard at the time. And I was just like, I'm going to be so stressed if I need to actually make a living out of the work that I do, but still be ethical and feel happy with the work that I do. And I didn't feel I was good enough for private dentistry, nowhere near there yet. So I then thought, there's something called core training. It means you get a real understanding of how dentistry is in hospital. And I thought, fuck it, let's just try it. And because I really enjoyed oral surgery at uni, really enjoyed it. Like, I felt like it was my home there. I really enjoyed those sessions. And when I was in practice in my first year, I really enjoyed that part too. Understand, I had good supervisors that would help me do it as well. So I was given some hands-on. I thought I actually want to get even better at that. And so I decided to go into core training, which involves having to do some exams, interviews, whatever. It has to be done. You have to get around and doing it. And I had a real variety of things. So I did something called oral and maxillofacial surgery 1 year, which involved doing night shifts. Who knew dentists did night shifts? We do. Yeah. So we did like weekend night shifts. We would do night shifts during the week. We do during the day shifts, like on calls as well. And that's when you carry that bleep.
Who were the types of patients that were coming to you in the middle of the night with something that you needed to fix?
True. So it would usually, so I was in Portsmouth, which I loved Portsmouth. Like, it's not the most beautiful seaside town in England, but how many seaside towns in England are beautiful? Anyway, that's not part of this podcast. Go to Spain. That's where you really need to go. But anyway, so people would come at like 4 a.m, having been in a fight, after having a few drinks, few cuts to their face. A&E don't want to do that because it's the face, right? And so who's going to do it? The dentist, who is there. And so we would stitch that up. Other things, broken jaws, people on e-scooters, having had a few drinks, flipping over, landing on their chin, broken jaw, lower jaw, upper jaw, you name it. Or a cute little old lady who tripped going down the stairs when doing her shopping, broke the floor of her eye socket as well. So we would deal with that sort of stuff. I mean, I say like I did them all. I would see the patient, like admit them in, make sure that they were looked after, and the ward round the next day, the consultant would come and we would make a plan as to what needs to be done. Nothing usually needs to be done in the middle of the night by the seniors. It's more we kind of like keep everything stable. But that sort of stuff, I put a caveat here, you have to also, if you want to get to the end of that, you have to have done medicine and dentistry. So that's like a really long career path. It's called an oral and maxillofacial surgeon. And they can do...
If you want to be the actual consultant.
Person that does the jaws, that fixes the broken jaws, that does huge cancers that need their jaw, part of their jaw removed, or, reconstruction, cleft lip and palate, things like that. Those are like, wow, incredible people that have to have done both degrees. But if you want to get more experience because you want to specialize in specialties within dentistry, and I'll talk about those, you need to get some exposure in hospital, where that's doing max fax, oral and maxillofacial surgery, by doing the broken jaws and the cut lips and taking out more complicated wisdom teeth as well, things like that.
Right.
You do that. So I did that 1 year, loved it. I think that's where I really thought, gosh, I think I should really go down surgery. Was tempted by doing max fax, but then I thought, Maria, remember why you did dentistry and not medicine. And so I kind of diverted from that. Did a year doing pediatric dentistry and sort of more special care in London that year. Really enjoyed that. Really like the flip side of dentistry in dental hospitals. It was an area that was, in East London, which you saw a wide demographic of patients, of pediatric patients mainly, that, had poor dental decay, that needed to have many general anesthetics. That's another problem in England. Loads of kids needing to have teeth removed. Very cute kids that you really want to help, but in need of treatment. Or kids that were on their skateboard, flipped, their front top tooth fell out, that came clean out. You have to pop it back in, splint it, and then do treatment for them long term. Yeah, that was cool too. I really enjoyed that.
I love how you're like, this is so cool, and my face is like, ah.
My eyes light up, but really enjoyed that, and learning different ways of sort of treating patients, young kids, whether that's through just while they're awake, while they're sedated, while they're asleep. That was really great. And in London, like, you just can't beat London. For me, like, being a London gal, like, I just really enjoyed being back in London and more the social side of London. But anyway, that's not dental related. And then I was like, right, Maria, you're kind of, you've done a few specialties. Like, you now need to decide a bit more what you want to do. And I was thinking, I just really love oral surgery, but am I good enough for it? It's very competitive to get in. But I thought, no, let's do DCT3 now. But of course, DCT3 meant leaving London. But it was worth it because I got to work in a unit that was near Sheffield called Chesterfield. Big up Chesterfield. You probably haven't heard of it. I hadn't heard of it until I got my post there, but it was honestly,
I hadn't heard of it until you got your post there.
And will you go there? Probably not. But for oral surgery, it was fucking fantastic. I loved it. Like, got really good exposure because the people that were there were like, Maria, you get what you put in, right? You get out what you put in. If you're dedicated and you want to learn as much as you can, go for it. So it was a maxillofacial unit, but it had a heavy emphasis on oral surgery. So we would see max-fax patients as well and sort of treatment plan with the consultant, but we would do more things like taking out teeth or more complicated teeth, and you become more accredited in certain things like intravenous sedation. So you can treat patients while they're awake, but kind of a bit drugged and they're just more relaxed. I feel like people in America have that. When they end up and they have the videos of them talking rubbish.
Yeah, like after they get there.
One of them wanted to be Nicki Minaj with big boobs or something. Yeah, like that sort of stuff. Either they've had a general anesthetic or they've had intravenous sedation. And so got to understand that more. And I was like, okay, like this is it. And so I thought oral surgery is what I really want to do. But I didn't think I had enough points to sort of go for it. So in order to get into specialty training, you have to have enough points to sort of be like, okay, you're good enough to enter the interview stage. And that involves going to conferences, doing publications, having done audits and quality improvement projects within your hospital to show that you are dedicated to improving the work that is done in hospital from a clinical governance point of view. So seeing an issue, addressing that issue, trying to form something to change the issue that is there and seeing the improvement, sort of showing that you're dedicated to long-term quality improvement for patients. So that's part of it too, doing certain exams, doing teaching. I didn't have enough points. And that was because I need to dedicate more time to it. So enter this year that I've got in this year. And I'm actually working in oral surgery as a specialty doctor in another hospital, which is near Liverpool. It's called Crewe. Again, another place that you would never think of going, and I wouldn't expect you to think of going unless you're on a train, because Crewe is the transport hub of the UK, of England. And most
that
people don't get off
important.
Crewe, but I do. And so I do that job. Honestly, lovely people. Really was able to have hands-on experience and become more independent, because when you're a specialty doctor out of poor training, you're much more independent. It's much more, okay, I'm really like, you do it. Come on now.
Yeah.
But I did that for 2 days of the week this week. This year, I've actually done something that's got a management and leadership perspective as well. This is completely different to what most people do in dentistry, because I work from home 3 days of the week. And no, patients don't come to my house to have treatment because that would be wildly unethical. But it's been great because it's a scheme that's with the Chief Dental Officer of England, who kind of is the head of dentistry, let's say, that kind of deals a lot with policy within dentistry and in England, and sort of is the spokesperson or sort of the person that people look up to when changes are being made within NHS dentistry. Sort of they look up to them, and he is fantastic. He's Jason Wong. He's amazing. Working with him this year has been good, even though I work in a different organisation from him. And it's been great to sort of understand NHS dentistry from a non-clinical perspective, but that helps the clinical side of NHS dentistry. So that's been fantastic. I've worked with the Business Services Authority, which are the people that basically pay the dentists in NHS dentistry, and that collect data from the work that is done in NHS dentistry, and finding ways to see what the data is telling us and how maybe the government needs to change their policies depending on the data that there is. That's very loosely explaining it, but it's been fantastic to understand the different levels within NHS dentistry, within an organisation as well, how that works, and how the management side really funnels into the dental and clinical side of NHS dentistry. And that was really good because it allowed me to understand that more. To then finally, she's finally got to it to apply to specialise in dentistry, and I got a post of oral surgery, which is now like it's going to be 3 to 4 years before I become a specialist, but it allows me to formally train. And you can do that within pediatric dentistry. You can do it as orthodontics. You can do it with restorative dentistry. It's more of a formal pathway. There is national recruitment. This is what I've done through national recruitment. And it means that I can, by the end, be like a bit more of an expert, a specialist in my field. And then I can take it different ways. But so I'm kind of getting to where I want to go, but I'm over the moon. Like, I still can't quite believe it. Like, it was amazing. I'm going to be back in London, formally in London, like finally not having to move from place to place, which although I loved it because it got me to where I am today, and I met amazing people and learned amazing skills, it's got me finally to where I wanted to go. So it was all worth it. Basically.
All worth it. All those moves, all those different hospitals, all the core training.
Yeah.
Your cold is coming. Your cold is coming. When you feel a cold coming, shorten it with Zycam, the #1 cold shortening brand.
Oh, no, not before my big trip.
The big trip you've been planning is coming up, and so is your cold. But Zycam can shorten your cold and get you back to planning sooner.
Thanks, Revere.
We really should keep Zycam in the house.
Shorten your cold with Zycam.
Take it from America's most revered messenger. Shorten your cold at the first sign with cold shortening products from Zycam, the #1 cold shortening brand. Available in stores or see where to buy at zycam.com.
Yeah.
So let me get this straight. You are working in multiple different hospitals, but while you're working in different hospitals, seeing patients, taking care of patients, you were also studying for these exams, studying for these interviews to make sure that you would get your next core training.
Yeah.
So then can you tell me what like a typical day would look like where you could possibly fit that all in?
Yeah, so I love it, but yes, it has some dark days, let's say, of being like, why am I doing this? Typical day. So I think a typical year is, you go through the waves in dentistry in terms of with what I'm doing. At the beginning of the year is more you settling into the job. It's not so exam and focus heavy, but it's a real time to sort of understand the job that you're doing, but also realize, okay, Maria, in 6 months' time, you need to have accrued evidence to show that you can apply for the next path, for your next post, let's say. So a typical day for me, this year is a bit different, but let's say about like last year when I was in Max Fax oral surgery, I'd wake up, probably go on a run because that's what I love to do at obscene hours of the morning, and then go there. If I was on call, I'd have a bleep. You know that when you watch those shows where the bleep goes off and everyone goes wild because it's like
a pager.
Yeah, a pager. Yeah, so you had a pager. And in the morning, if there was a patient that was on the ward that maybe I needed to see them, would go and see them before I started my clinics. My morning clinic would be either seeing new patients or follow-up patients, patients that have been referred from practices in the area. They're like, oh, I can't actually do this complicated tooth, or oh, this ulcer on the tongue looks suspicious, I need this to be seen in hospital. We would see those sorts of patients, either treatment plan them to have this complicated wisdom tooth removed at a later date, or say, actually, you could have cancer of the tongue. This is what we need to do to kind of start the process. Scans, planning to have part of the ulcer removed to see if it is cancer or not, and then going from there. So that would be like a morning of that, let's say.
Just a morning.
Just casual, like no problem like that. And you might be bleeped in the morning to be like, by the way, there's someone in A&E that like has a cut lip. Can you please go and fix it? So you kind of have to balance that up. And then let's say in the afternoon, let's say with my colleague and I, we had a half day of doing the bleep, then the other person would do the bleep for the second half of the day. Or not, you might still have the bleep. Then you...
Wait, is it actually called the bleep?
Yeah,
like,
the bleep.
This is...
Like the bleep test.
Okay.
But
like,
but you're constantly
in
running.
England, it's called the bleep. It's not a pager.
No, it's not a pager. I don't think... No, yeah, the bleep. Yeah, the bleep. Yeah,
okay,
yeah.
continue.
Watch how people are going to comment and I'll be like, you're so wrong, Maria. Like, in my place, they call it this or that. No, in my place, they call it the bleep, and it will remain the bleep. And I hopefully never have to hold a bleep again. And then in the afternoons, maybe I would do treatment. So whether that was doing biopsies of suspicious looking lesions in the mouth or on the lip that needed removing, would do that, or removing wisdom tooth or removing a decayed tooth for a kid. That would be like my typical day. Or I would go to theatre and we would do that stuff while they're asleep as well. So if you've got like a tooth that's up in the roof of their mouth that needs to be explored, found and pulled down slowly for orthodontists to do things, and we would do that, for example. That was I loved that year. It was fun because it was in the north and you saw a whole array of things and I loved it. This year is a bit different. 2 days in the week, I kind of do the same thing, let's say, but it's in a different unit. And then the other 3 days in the week, I work from home, have meetings with different people within my organization or within other organizations within NHS that sort of involved with NHS dentistry, doing projects, looking at data, analyzing that data, presenting it to people within NHS England, for example, to sort of show them how maybe things need to be changed or implemented in certain ways to help get the most out of NHS dentistry, whether that affects contracts going forward, the national contracts and things. So sort of working on that or writing up a paper, things like that I've been doing this year, which has been really interesting. So yeah, variety. And sorry, you told me about a typical day. I finished that and then I would go home, make some funky quinoa salad or something with the ice cream afterwards. And then I would have to study. Yeah, there's no going. So this year I've had to really study. I became a bit more of a social recluse. So I hibernated a bit more by having to find the time to dedicate long term to getting to where I am now. So that's practicing questions, finding different scenarios that they may ask you in an interview, being prepared for anything that they may ask you and throw at you, being able to back it up with evidence of what you have done, whether that is the audit that you did, whether I have to collect data for an audit. Last year I did that. This year it's being able to evidence, I did this audit, these were the positive changes that came out of it, and this is why I'm a dedicated clinician wanting to get long-term change. So kind of, yeah, from last year to actually doing the audits to this year actually evidencing the audits that I have done to allow me to get into specialty training. So it's all like a long-term trickling process to get to it. So
that is incredible that you are doing a full, incredibly hands-on day and then having to come home and continue to study, continue to use the brain. That is so impressive. I want to ask, was it really weird to go from so many years of such a hands-on, tactile, stitching people up type role to now you're like looking at data in a remote job? How is that transition? But also now you're just clearly so multifaceted that you can do both.
I never thought I would end up doing something like that, but I'm so glad that I did, right? In the sense of, luckily for me, I was able to have that balance that I still was able to do some clinical work to just keep my head in the game and show that actually I want to do clinical work. But doing this, was a real jump. For me, mainly the real jump was actually working from home. I have friends that say, work from home, it's the best. I personally goes to show that I love working with people because I struggle to communicate through a screen and really understand someone, right? Like, I think that's why I love working with patients. So that for me was a huge transition. It's great because while you're working on data, your laundry is also being done at the same time, right? Or like you've got, you know, towards the end of the day, you're able to then prepare stuff to bake a cake in the evening, right? So like you've got that flexibility with it, but it's very different. Yeah, I had to channel a different part in my brain to kind of work in this field. Usually when I'm clinically working, I take a tooth out, and as lovely as it was to meet that patient, I hope to never have to see them again because I work in hospital and they get discharged, etc. Here, when I worked with data, it was actually waiting a while to understand what data do I actually want to get, what's going to be the most meaningful data, then waiting for that data to come, then having to analyze that data, then writing up a presentation to present that data and being able to sort of convince the people that you're sort of presenting this to say, listen to what I have said, this has got meaningful change to it. So having to actually think about the end goal and work backwards, which is not, you do have to do that clinically as well. Your end goal is to take that tooth out, make sure you do it safely, how are you going to do that, what scans you need, etc. But here it's like a huge timeline, things that you've been working on for several months and having the patience to carry that through. And when when the data may not show what you want it to show as well, that's also something that I had to sort of get used to. And also the response to the data that you present. How are people going to react to that? Are they going to take that on board? Are they just going to say, actually, find me this instead now? Or are they going to say, no, this work is not? That's not something I'm used to. I'm used to working collaboratively with people to help patients. And it's working with patients individually when you're working clinically. Here, when you work with data, you're working for patients at a much higher level, much more of a national or regional level to say, actually, the data that I'm showing here will affect future patients on a grander scale. So it's, lots of different elements to it that I learned a lot. And you need to work with patients clinically, but you need to have patience in the data one as well. So it's a different patience that you have to have for it. So
very fair enough. It's just so impressive that you could like switch your mind from one to the other within the same week.
Your cold is coming. Your cold is coming. When you feel a cold coming, shorten it with Zicam, the #1 cold shortening brand.
Oh no, not before my big trip.
The big trip you've been planning is coming up, and so is your cold. But Zicam can shorten your cold and get you back to planning sooner.
Thanks, Revere.
We really should keep Zicam in the house.
Shorten your cold with Zicam.
Take it from America's most revered messenger. Shorten your cold at the first sign with cold shortening products from Zicam, the #1 cold shortening brand. Available in stores or see where to buy at Zicam.com.
Going back, kind of, I guess, looking more into the hospital work that you've done, because that will be the main thing. You're going back to that kind of work when you start your specialty training. Yes. So what, aside from like the evident technical skills that you have and you've spent so much time learning, what are just some of the soft skills that you are using on a daily basis that make you good at this job? Like, I know you just talked about patience and you're obviously spending so much time with people, but like, what makes you so good at what you do?
To be honest, the soft skills, I think, is what really can set a great clinician apart from another clinician. People hate the dentist, right? Like, it's not, when people come and see me, I always joke around with them and say, listen, I'd be concerned if you're excited to come and see me today. Like, understandably, this is not where you'd like to be on a Friday afternoon, sort of like come to see me to have your wisdom teeth out. So those soft skills are really important because patients come in expecting something to be done for them, or some of them come in being like, I don't know why I'm here, kind of thing, like, help me. So it's being able to ascertain communication is essential here, being able to understand the communication style that your patients have and being able to sometimes communicate back to them in many different ways. So it's being able to ascertain, is this patient anxious? Do I need to talk to them using different words, using different language that will keep them at ease, that will make them feel comfortable to be able to have the treatment that I'm suggesting for them to have? So definitely need to have great communication skills to build up rapport, building trust. If you build trust with a patient, you could genuinely do anything you wanted to do, in the sense of, and obviously explaining risks to them that can sound quite scary, even though they're rare risks, being able to explain to them in a way to say, okay, I understand that is a risk. I'm hoping that your clinical skills are good enough to avoid that risk from happening. But if that does happen, you've explained it well enough to me for me to feel comfortable to deal with the consequences of it. So it's having that communication skills. You've got to have a bit of, as I say, rapport with them. Understand them as a person as well. I always ask them, what is your job? How are you finding that? Things like that, because it helps me in a clinical side. They don't realize that, but it helps me in another way to sort of get to know them. Or when I see them next, when I'm going to do that treatment for them, I ask them, how is that going? How was that project that you had? Things like that, being able to understand them more as a human, I think for patients really helps. You're not treating them as like a thing that you hope to never see again, even though that's what I said. You kind of want to make them feel at home before they have this tooth yanked out of them. So I definitely would say that's a skill that you have to build from that. Time management, my God, you need to be ready to juggle. I'm hoping to get to a level where my clinical skills are so efficient and good that, that it will take me less time to do a good job out of something, which I can handle more things, juggle more things, time management, being able to balance what's best for the patients, making sure that I'm also making sure that I'm doing the things that I need for myself to continue excelling with it as well. So I'm just keeping positive. Like, I think you can really get bogged down in the negatives of the work that you're in. And I wish I was earning more money in private dentistry. That thought crosses my mind every now and then, don't get me wrong. And it's definitely something I will do in the future. But right now developing myself professionally as a person so that when I get to a good standard, I can then almost like give back to myself by maybe being able to earn more as a consultant, whether I work privately. But now it's kind of just keeping positive, showing enthusiasm. Your patients notice it, the people that you work with notice it too. And when you work in hospital, it's such a team effort as well, that if you're not pulling your weight, it will get noticed. So you've got to keep working as a team to help each other out, but help yourself out too.
Speaking of like working as a team, and I'm assuming you're doing these programs with other people.
Yeah.
Who is guiding you along this road? Who is telling you, you know what's a good idea? Go do this dental cord training, apply for this specialty, teach this class, do this conference. Like, is someone helping you, or are you just kind of doing it by yourself?
No, I would hate to do this alone. My God, I would be depressed. It's interesting because you work as a team, but sometimes in the teams that you work with, people are going for the same job that you're going for as well. Like it's a tricky one because you want to help everyone out, but at the same time, some of you are going for that same end goal. So you want the best for everyone, but also you need to remember, gosh, I need to also like make sure that I get what I want to. Yeah. So in terms of guidance, that definitely happens more towards the end of what, like kind of where I am now. But at the beginning, I think making sure when you're in foundation training, you're getting the skills that you want as a first time graduate, and having a supervisor, which you're not really sure who you're going to get to supervise you. It's the person who works in the practice that you've kind of been semi-allocated based on how well you do in interviews, but also how you rank it as well. So you need a supervisor that gives you the time and day to say, Maria, like, what do you actually want to do? And at that time, you might not actually have any idea. And it's better to not have an idea so early on because it allows you to keep your mind open. But I guess the supervisors that you meet along the way, whether that's a consultant, whether that's someone that's like a registrar, whether that's someone that's been in the hospital that you work in or in the practice that you work in for so long, that has kind of seen everyone go through, that has seen how NHS dentistry has changed the landscape, and that can sort of guide you down a certain direction. I think also the peers that you meet along the way, there's other people that are dental cord trainees as well, that yes, they want the same thing. They might want a different specialty. They might want the same specialty, but working together, you've got to meet the right people, because I think if you find those people that you really click with, you're going to help each other out. You're going to say, oh my goodness, there's a course that I think will really help us. Let's go for it. There's a conference. Dentistry is a very small world, and it gets even smaller when you get into hospital as well, because it's a smaller part of dentistry. So if you find the right people, you're gonna, and you usually do find the right people in that sense, like your group, you help each other out because you all want the same thing at the end. The part that will differentiate you is more who you are as a person, how you can tailor what you have done to showcase, I'm good for this role, I'm good to do this, I'm good to do that. And conference is a great way to sort of network as well, meet amazing people that have done fantastic things, groundbreaking research, or, you know, they've kind of found an issue that they managed to improve, or different techniques. And going up to speak to them, they love chatting about the work that they're doing. They love seeing someone that's enthusiastic. And that can also build connections that you never know in the future might actually be quite useful. Yeah. And I'd say the last thing with the work that I'm doing this year with the data stuff, let's say, it's building those connections that in the future, maybe when I'm a consultant, hopefully, touch wood, and you know, but also wanting to delve into the management side, being able to work at a level where you can make changes, whether that's in education, whether that's in specialty training, whether that's in policy. You've made these connections now that you help to continue build, so that when the time is right, you can go back into this role after my clinical years and say, actually, I want to help out in a more non-clinical aspect. So it's just keeping, as I say, like keeping positive, engaging, and not kind of being a teacher's pet, but kind of showing passion for it. That will get seen. It's
amazing. I didn't realize, and I feel like that's something that people wouldn't realize, like how important it is to maintain connections in this world in order to help you progress later on.
But also because you find it interesting and you want to like help people out. Like this year hasn't been long enough for me to understand more the non-clinical side. I'm genuinely interested, and if I could, I'd continue being part of it, keeping up to date, because I've met lovely people that I want to still work with, both for myself, but also because of the work that they're doing is amazing. So, yeah.
What do you just ultimately love about this work. You've talked like, you're like, I love oral surgery. My eyes are lighting up as I'm like cringing at the idea of like an ulcer on someone's tongue. You're like, I just love it. So what is it about this that you just love so much?
Good. Yeah, I don't have a tooth fetish. Let's just say that.
No?
Well, I don't
Is
have teeth
that a
fetish because I
thing?
like taking the teeth out, to be honest. So
Yeah, you're like, get rid of them. I don't want to see them.
Why do I like doing it? I think I just really enjoy helping people out in ways that I didn't think was possible. I know that sounds really, I'm really in awe of the dentists that manage to do amazing makeovers of the mouth, the people that come in with teeth that have seen better days and they can transform it in a way that is unbelievable. Like those people, I've got friends that do that and I love hearing about it. I just feel like I've got a different mindset in the sense of I don't think I'm cut out for that. Like that, you need a different amazing brain to do that. For me, I'm much more black and white in that sense. Of patients in pain, I want to help them. Like, let's do it. I think when I started working in Aldershot, you would see patients in so much pain and difficulty. They were able to see a dentist like me, for example. But then when I decided to explore that further in MaxFax, you would see patients that have a fear of dentists, that means they haven't seen the dentist in years, to the point they've got a swelling that's this big, that means they need to have the swelling cut, etc. So you see a real array of people. So I think it's a nice mix of being able to help people out, but also from my side, having a surgical aspect to it. Yes, I could have done surgery in medicine. I've got my family being more surgeons in medicine. I could have definitely gone down that route, but this is a work that I can help people out on, let's say, a smaller scale. But for them, people say toothache can be worse than childbirth. Okay, so being able to help people out in that way, in a way that is as painless as possible, and make them feel at ease and make them build that confidence in order to continue seeing a dentist in the future. For example, what I'm trying to say is I would get pediatric patients that were terrified of opening their mouth when they initially saw me, and working and building on that rapport to then afterwards, they'd come running in, almost come and see me to be like, I'm here, I want my sticker, I will open my mouth and you will do treatment for me. Because long term, when they are adults, they will have the confidence and the trust to be able to continue seeing a dentist in the future. I think the adult patients that I see now were terrified when they were younger because dentistry had a much different side to it. Then it was more like, you listen to me, I'm the dentist, I'm going to do my work, go. Now it's much more on the patient is the boss, right? They are the ones that you want to get help them out with. So it's more of building them that confidence that when they're adults, they're like, I can go to my dentist regularly, I can get checked up regularly. Prevention is key here. If I see them regularly, I can spot things earlier on, I can stop it from getting horribly wrong, whether that's an ulcer on the tongue that has waited for too long that's turned into a raging cancer, whether that's a hole in the tooth that started really small but that by the time they see you it needs to come out when it could have been saved. So it's being able to prevent things from getting worse by building that rapport. I, of course, now am at the other side where I just have to take the teeth that are bad out, or I have to remove impacted teeth or expose impacted teeth to help other specialties do work. So I think what I really enjoy is the variety. It's not just doing a filling. Well, I don't do fillings, to be honest. It's that variety of patients through different ages, helping them out in different ways and getting successful outcomes out of it. I think that's something that I enjoy. Yeah, so I just love the variety, being able to help people and seeing them leave where I've been helping them and carry on with their life in a pain-free way. That really boils down to that.
I mean, kind of similar question, but why dentistry in the first place? I know from knowing you that we had this long conversation between, medicine and dentistry, and you mentioned it earlier today, but tell our listeners, what was it about dentistry that spoke to you?
So I come from a family of doctors, parents, both doctors, divorced, remarried doctors. So I never had a sick day of school. And I think I did work in the UK. It's really good to get work experience to kind of see what sort of things you like to do. So I did law, I'd go to an office. I loved that lifestyle. I felt like, in a cool outfit into the city. Obviously I went to Pret, yada, yada. Did that, but also worked, did work experience in a hospital, saw incredible things. I saw more obs and gynae stuff. And then I also worked in practice. And I think having grown up, my parents were at home. I had a very loving family, but it wasn't one where I would see them all the time, right? I had nannies, I had maybe an au pair from time to time. It was, because my parents were dedicated a lot of the time to their patients, to their job. So I didn't see them that much, but they got to help patients. They got to help people out. So I thought it was my mum actually that made me think, Maria, like, why didn't you look into dentistry? You can help people out. She was wrong in this sense. No one's going to die of toothache. They're not going to die of toothache if they get it treated eventually. But, it's something that can wait a day, right? Usually.
Yeah.
I see things I'm like, do I have to?
Yeah, I know. I'm getting very nervous. This whole interview, I've been touching my face. I'm like, wait, am I missing something? Oh my gosh, thank you. I also do have my dentist appointment booked for July, so I'm good.
Go to it.
I will.
Yeah, so I think it was that combination of being able to help people out in a way that, being selfish as well, that I want to have a family. I want to have time dedicated to that. I think dentistry allows you to be a bit more flexible with that, especially work in practice. You can decide to say, you know what, I only want to work 3 days a week. I make enough money. That's good enough. I can spend 2 other days with my kids. That for me, I love that idea of being able to be a bit of the boss of your own person. Not right now, because now I'm going to enter a different stage, but eventually I would like to get to that. So being able to help people, but also help myself as well, both from a personal, financial point of view and long-term as well. And it's a good career progression. Everyone has teeth, right? You're always going to need stuff doing with that. So and I really enjoyed my sciences, and so I thought that's
Your cold is coming. Your cold is coming. When you feel a cold coming, shorten it with Zicam, the #1 cold shortening brand.
Oh, no, not before my big trip.
The big trip you've been planning is coming up, and so is your cold. But Zicam can shorten your cold and get you back to planning sooner.
Thanks, Revere.
We really should keep Zicam in the house.
Shorten your cold with Zicam.
Take it from America's most revered messenger. Shorten your cold at the first sign with cold shortening products from Zicam, the #1 cold shortening brand. Available in stores or see where to buy at Zicam.com.
Before I let you go, I do want to get some very specific advice from you for anyone listening considering this path.
Yeah.
So starting with just what advice would you give for someone who is interested in the field, isn't sure, but is interested in becoming a dentist, maybe looking at some dental programs for undergrad, but also looking elsewhere?
What's advice I would give to them? I think it's dentistry is definitely thinking outside the box. Most people, I think when we were at school, it was much more about, I think I was one of the first people at school to have gone down dentistry instead of medicine, because vocationally medicine is the one that people do. So I think it's a bit advice on that. Think outside the box. Think about what do you want to do eventually long term, in a healthcare setting, helping people out. Don't think that dentistry is a narrow, is just working on teeth. Hopefully I've definitely, I think, probably shown that that's not the case.
I think you've definitely shown that, yes.
Because you can, there is definitely a dental side to it, but it's not just working in practice doing that. There is definitely that, and that's what the majority of dentists do. But there is another side to dentistry as well. And that can open so many avenues, or whether that's going in management and leadership. Some people go and do it in the army, some people work more in community with it. So don't just think that you're just going to work in the sort of that traditional dentist style. I think dentistry has that amazing combination of theory, scientific theory, but creativity as well. Those that work in practice, they can make fillings look like natural teeth, right? That there's an art to that too. And that also involves having to have a very multidisciplinary mindset, in the sense of, this patient needs to have this tooth worked on, but how's that going to impact the rest of the teeth as well? Because that could cause problems for other teeth. So it's having that creativity to think a bit outside the box, but be quite strategic with it as well. And so that's the advice I would do. Whenever I used to help out when I was at Bristol, I love Bristol, and people would come, prospective students, and say why Bristol? And I would say, to be honest, when you're thinking about what program to do, you're going to learn, there's 32 teeth in the mouth, usually, okay? You're going to learn about 32 teeth wherever you go. I know in the US it's different in the UK. So you're going to understand the program, etc., but also get to know the city that you're going to be spending 5 years in as well. I think the city is really important, and it's so not dental. But I would always tell people, Bristol is great. The degree is great, but also understand the city that you're going to be in as well. Is this a city that you want to be in? Is the campus the kind of campus that you want to have as well? So that's definitely something I would take into account. And advice-wise, keep an open mind. You might think, I want to be an implantologist in 20 years' time. probably you won't end up being that, because you'll find something along the way that has caught your interest that you didn't realize. I think there is dentistry is a bit more medicine than people realize in terms of specializing, in terms of management side. So if you want a bit more of a relaxed lifestyle, in the sense of, well, you can make it what you like. Some people don't have a relaxed lifestyle in dentistry, but if you want it to be more 9 to 5, a bit more be the boss of your own life in that sense, give dentistry a go, or like consider it. Definitely get work experience.
What words of advice have gotten you through your toughest day at work?
I'll give you a good piece of advice that someone told me, because usually in dentistry, the area that I've worked, I think, okay, that tooth needs to come out, let's do it. Or this jaw needs to be investigated in this way, let's do it. And actually, one of my consultants that I worked with, who was amazing, actually said to me once, good surgeons, or you could say dentists, know how to operate. Better surgeons know when to operate, and the best surgeons know when not to operate. So I think in the world that we live in, it's a lot of like, I must do some quantitative work to sort of showcase that I've transformed this to this, when actually sometimes not doing something in the sense of not having to actively drill a tooth, or actually having to take a tooth out, etc., is the best way to go about it. That's probably advice that I really learned, being okay with saying, I don't think we should go down this route, perhaps another route, or talking about prevention. Okay, we'll fix this tooth for you, but to avoid this happening with your other teeth, preventing not doing something, make sure that you're brushing your teeth, make sure that you're doing this or that. So really understanding the positive and the benefit of taking a step back sometimes, and looking at the bigger picture and say, actually, going down this route may not be the best, think about it from this perspective. And the reason I laughed is because I think I naturally became a shit magnet wherever I worked, just because I would get the bleep all the time wherever I was. Yeah, like my friend would be on call the day before. I was like, yeah, it was fine. I just had like a few cuts to the face that I needed to stitch up. Maria Day, right, would rock up, and it was like, oh no, I had to deal with this and that, and making it seem like playing me a violin, but it was like I would be a shit magnet having to do this. But also, a patient on a ward has suddenly said that they have a problem here while dealing with a kid that has just come out with a broken tooth. Anyway, but I kind of, maybe to make myself feel better, I'd be like, Maria, you are a shit magnet. Just admit it. It's okay. That is you. But
I love this word, shit magnet. Yeah, that is hilarious.
I do it as an emoji as well, like the poop emoji and then the magnet emoji. The reason I say that is, I would always say, I think someone once told me was, you're a shit magnet. You are. Sorry, Maria. But why are you a shit magnet? You're doing things well. Patients are being treated well. Perhaps you being a shit magnet is meaning that the patients that need your help are actually getting the help they need. So I kind of made it look positive to be like, I'm a good shit magnet. Like I care for my patients. So although it's going to be an extra burden, I probably one day will leave at 9 at night instead of 7 at night. Okay. Yeah. It meant that I've managed to help this patient out in the way that they need to. So that's probably, it was basically the advice was, look at shit magnetism in a good way kind of thing. So you'll hopefully reap the rewards later. And maybe that shit magnet day that I had that day helped me to become a better clinician, to allow me to get to where I am today. So like, take anything by the balls and just go with it.
I think that's excellent advice. And so true. I do think that, what is meant for you comes to you. And, maybe that means the toughest patients are meant for you.
Yeah.
Because you are so good at it. What do you wish you'd known, if anything, before you embarked on your journey of dentistry?
That it's okay to play the long game. I think it's very easy to get sucked into the money. So, and firstly, if you want to be rich, like good, like mega rich, don't do dentistry. Yeah, you'll be fine with dentistry, but if you want to make the big bucks, like please go to a law firm or a finance firm.
Honestly, so real.
But play the long game in the sense of, I think when I was in dental school, I really enjoyed it. So, especially the oral surgery side, but I thought, can I see myself doing 30, 40 years in a practice, day in, day out, seeing patients, or I feel like I was going to stagnate and sort of reach a plateau. So playing the long game, yes, has meant that I've had to do a few years in hospital. I've now got to do specialty training, which I'm very happy about, but play the long game in the sense of find out, is that, you're going to be doing this career for many, many years. Play the long game. Say yes to a lot of things. I'm not saying say yes to everything, because I've said yes to everything in the past and it hasn't always worked out. So, but as you learn more about yourself, you know when to say yes, when to say no. I've said the long game like 7 times already, but in the sense of, see dentistry as being actually a long trajectory with lots of different branches, and they will all help contribute to make your job varied. There's this thing in dentistry now called portfolio career in dentistry. That means not just being in practice, seeing Bob and Jane every day. It's kind of a few days maybe working in practice. For me, I'd be able to maybe work a few days in hospital, and maybe actually have one day where I work from home, that while my laundry is washing, I'm also helping to map the landscape of oral surgery for the better long term. Things like that. So by playing the long game, and by this extra year that I've done with the data work that I have done, it's not really a year lost, because I've gained so much that I could hopefully use in the future that maybe someone that didn't have this opportunity might not have as well. So don't just think dentistry is about teeth. It is really, but there's so many sides to it as well. And be prepared to explore that with open arms, because you'll reap the benefits of it long term. Absolutely.
I mean, you have shown that without a doubt.
I'm literally the weirdest in terms of I'm not a normal dentist. When I've just been away traveling, and people are always like, oh yeah, what do you do? I'm a dentist, and I have to say I'm not a normal dentist because I actually work in hospital. They're like, huh? But yeah, it's interesting. It is really a different world, and I will eventually want to get back to practice to do some sort of it in a different way. So there's always that idea of playing the long game will allow you to do a lot more variety, I think, as well, and keep the job interesting.
Exactly. Keep it interesting. I think that is so important. And that's so important for everyone who is looking at their careers, because, you are doing this for a very long time. You better enjoy the day in, day out, as well as the overall end goal.
Yeah.
1000%. Well, truly final question for you now.
Okay.
You've spoken a little bit about it, but I want to hear about it in more detail because it's so exciting. It's your specialty program. But for you, Maria, what's next?
So what's next for me is, in September, I'll be starting doing specialty training in oral surgery in London, which is 3 to 4 years, which will be amazing to sort of become a bit more of a master in a field that I really enjoy in a unit in London that is renowned for being fantastic. So I'll be learning from the best people, working with an incredible team, and gaining skills that I'll be able to help utilize for patients in the future. And I think while doing that, just understanding more about myself, the route that I want to take. So that's what's next for me. And I will probably in the meantime sprinkle in a few marathons, and high rocks is what I want to do next. That is my next goal. Have you heard of high rock?
What's a high rock?
You haven't heard of high rock? Girl, you're not on Instagram though, in the sense of you haven't seen that side on Instagram, I guess.
My side of Instagram is very different. There's no running on it. Trust me.
High rocks is a bit of running, but it also involves a lot of HIIT stuff as well. So you do 1 kilometer of running, and then you do 50 wall balls, and then you do another kilometer of running, and then you do ski ergs. Have you heard of those? A kilometer of running and rowing. It's become a craze that people are really trying to get into. So that's probably my next non-dental task.
And why do you want to do that?
I'm really into my fitness. I've heard it is an amazing, it challenges you on so many different elements. Stamina, endurance, cardio, strength as well. You use weights as well for certain parts of it. And you can do it around the world. There's some in Copenhagen. They do it in New York. They do it. So you can do
Come to New York.
Come to New York. Don't tempt me for now. Let me start my job. And so that's probably what's next. Yeah. Starting my job there, getting to look back into the London life of sort of being in one place for several years. I haven't done that in a long time, and I'm looking forward to it. Sprinkling that in with some fitness, and that's what's next for me. You'll interview me in 4 years' time when I finish. Let's see what I'm saying then. But
I'm so excited. I will definitely do that. Well, good luck with your specialty program and specialty training. That is going to be awesome. And congrats, because that is indeed so huge. And clearly from what you've shared with us today, you have worked incredibly hard for it. So good luck.
Thanks.
Good luck with high rocks. I
if I get into one, I'm trying to get one, but they are so popular that it's all like sold out. So I'll get
People
there.
are nuts.
Yeah,
People are crazy. That is,
I will join them.
You will never find me. Yeah,
no. You sometimes have to do doubles. So sometimes there's high rocks doubles where you do it with another person. So maybe you'll be my person.
You can find someone way better than me for that. I can guarantee.
Interview me while I'm running. I'll be like, Lacey.
Honestly,
no.
That would be hilarious. That would be quite the scene. I would love to do that. See you thriving at it, because you're not gonna even drop a sweat. Anyway. All right, Maria, this has been so wonderful. Thank you so much for coming on and sharing your story.
Thank you for having me, Lacey. Thank you so much.
Your cold is coming. Your cold is coming. When you feel a cold coming, shorten it with Zycam, the #1 cold shortening brand.
Oh, no, not before my big trip.
The big trip you've been planning is coming up, and so is your cold. But Zycam can shorten your cold and get you back to planning sooner.
Thanks, Revere.
We really should keep Zycam in the house.
Shorten your cold with Zycam.
Take it from America's most revered messenger. Shorten your cold at the first sign with cold shortening products from Zycam, the #1 cold shortening brand. Available in stores or see where to buy at Zycam.com.